All right. Want to welcome everyone to this meeting. I know folks are still filing in, but I think we're going to go ahead and try and get started. I know that we're going to have to end this one at 2 p.m. I know the thing said 3, but we're going to have to cut it off a little early. So yeah, just looking at the agenda, we have a welcome. Do want to welcome everyone. Take a moment to appreciate the perspectives that everyone brings, and then head into the first agenda item, which is data on claims and data related to paid leave Oregon. I see we have Andrew Powell with the DCBS research team tagged for that one.
Yeah, hi. I'm having a bit of trouble with my camera all of a sudden, but I'm happy to dive into that whenever it's my turn.
Sure. Would you like the information up on the screen, Andrew? Would that be helpful?
That would be helpful.
Okay. Bob is going to get that up on the screen for you. There we go.
Cool. All right. Yeah, thanks for joining us, everyone. I'm just going to be presenting on an analysis that I put together along with my colleague Raphael as a result of some questions we got coming out of this subcommittee. And the purpose of this is just to review some of the income limits, both for different levels of services and eligibility for different programs within Oregon. And I think the idea here is that this would just give us a better idea of how other Oregon agencies consider what kind of like a living wage would be, and also what a wage that would be low enough that someone would need, assistance with different types of programs available to them. And so we're starting with paid leave Oregon. Paid leave Oregon is a pretty new thing. And it basically provides individuals up to 12 weeks within a 1-year period of family, medical, or safe leave. And, the idea is this would allow people that don't have employer provided leave to take it if they have, family emergencies or just things within their family that require them to go to take some time off work and, not have to worry about not receiving income during that time. And it's basically eligible to most people within Oregon. There are a couple exclusions that I didn't get into here, but what I'm going to get more into is just the level of benefits that are received at different levels of recipient income. And so the way it works is it basically takes into account both the benefit recipients' average weekly wage, which is calculated basically the same way that we calculate average weekly wage within this group. And it takes into account the mean or average weekly wage within the state of Oregon. And it divides things up into 3 tiers based on what the individual's average weekly wage is relative to the average weekly wage of the entire state. And I'm going to use, for some illustrative examples here, the 2024 statewide average weekly wage in Oregon, which was $1,331.48. And so the first kind of lowest income tier for this is anyone that makes at or below 65% of the state average weekly wage. And so that would be 65. I didn't actually calculate exactly what that number would be, but it'd be 65% of $1,331.48. An example for 2024. And so, I give the example here of if someone made 50% of the state average weekly wage, which would be $1,331.48 times 0.5, would come out to $665.74. You would basically multiply that by 1. So they get their average weekly wage at that point on a weekly basis. So if someone makes under 65% of the state average weekly wage, it's a very easy calculation. It's a little more complicated if they fall in the middle range, which are individuals making between 65 and 120% of the statewide average weekly wage. And for those individuals, their benefits would equal 65% of the state average weekly wage plus 50% of any wage of theirs above the 65% statewide average weekly wage. And like I said, that one's a little more complicated. And so I'm going to give the example if someone made 100% of the state average weekly wage in their position. So they made $133,000 and $1,331.48. It's Friday afternoon. I'm starting to lose it. Their benefit would basically be so 65% of the state average weekly wage, which is $1,331.48 times 0.65, that equals $865.46, plus 50% of the amount they make above that. So 50% of $1,331.48 minus $865.46. And so that would come to $1,098. So they would make, less than what they would be making if they were working, but not a ton less. And then again, the calculation is really easy if they make over 120% of the state mean average weekly wage. And for those individuals, they get paid 120% of the state average weekly wage. So if someone made 150% of the state average weekly wage, or $1,997.22 a week, then they would get 120% of the state average weekly wage, which would be $1,331.48 times 1.2, which would be $1,597.78. I've thrown out a lot of numbers. Does this make sense to everyone? Is this helpful, the way I'm presenting this?
Yes,
Okay.
I think it's helpful for me, and I appreciate the layout of the tiers, somewhat similar to the conversation pieces that we've had about a potential tiering of work comp rates.
Mm-hmm.
So I think this provides something that we can do an apples to apples comparison for another program. So thank you for that. But happy to take a moment if there are any stakeholders or Stacy, any comments or feedback on this yet?
For me, very clear. Appreciate the walkthrough. Thank you.
Sure, no problem. And I will, like, one caveat, I am not an expert on any of these programs. This is something that I, in conjunction with a colleague of mine, just started diving into as a result of feedback from this. And so if there are questions that kind of dive into specifics of the programs, it's one of those instances where we'll just have to go back and do some research. So the second question that came up was around what the basically income cutoffs were for other Oregon state benefit programs. Oh, wow, thank you. That was very quickly reactive to me moving on to the next section. I didn't even say anything. And so, we went in and found a variety of different state programs that provide services to individuals that are below a certain income level. And because pretty much all of the state agencies that have a cutoff, they use what is called the federal poverty limit, which is for the United States, 50 consecutive states, is currently $15,650 a year for an individual, and then you get an additional $5,500 for each additional family member. So the cutoff for these is based on the federal poverty limit, which is based on family size. And so the income cutoff would vary based on an individual's family size. And so, we included a variety of different programs here from different agencies, including the big one is the Oregon Department of Health and Oregon's DHS. And basically, a majority of them use somewhere around the 185% to 200% of FPL, which, again, like I said, varies by family size. And so to illustrate this, I included 3 columns, one for what that would be for a single adult, what that would be for a family of 3, and what that would be for a family of 5. And in parentheses, I included what that would come. So the first number there is the annual wage. That would be kind of like the cutoff in terms of like what a family can make at the maximum level. And then in parentheses, I basically divided that by 52 to give us an idea of what that would be like in terms of weekly wage, since, you know, this is the weekly wage subcommittee. And so, so SNAP, or the Supplemental Nutritional Assistance Program, and the Employer Related Daycare Program, along with ODHS's JPI, or Jobs Participation Initiatives Program, all use 200% of the FPL, which would be $31,300 for a family of one, $53,300 for a family of three, or $75,300 for a family of five. You know, other programs use around the 185% of FPL mark, which is slightly lower than that. There are two temporary assistance for needy families programs that have different cutoffs. I don't really know a ton about the employer payments program and why that one is so much higher than the others. And then there are two different Oregon health plan programs that have different cutoff levels. I believe that the difference is that the Bridge program has a higher ceiling for income, but it provides fewer services. I think the main difference is that it doesn't provide long-term services or health-related social needs. And then I also included the cutoff for that's considered for affordable housing within the Oregon Affordable Housing Covenant, low-income households. So this is if there's a covenant associated with property that stipulates that property has to provide units for low-income families, like what that cutoff would be. And that doesn't use the federal poverty level, that uses area median income, and it uses the county as the level of geography for that. So I included what that would be for Multnomah County, and annually that would be $118,000 or $2,269.23 per week. And, you know, that's Multnomah County, so that's probably the most expensive county, or among the most expensive counties in Oregon. If it was, you know, maybe a less high cost of living county like Baker, or, you know, a county that's more rural like that, it would be quite a bit lower. And that is all available online. You can just kind of Google Oregon County area median incomes, and that's all like readily available. And so that's this. And again, I am far from an expert on any of these programs. I would like to be, because it's interesting, but I don't know if folks have questions about this, or if anything here isn't clear, or you have questions about how any of this was determined. I'm happy to discuss that now. It's pretty straightforward.
Not seeing any questions yet. I do want to thank you for breaking down the weekly as well. That is helpful for the conversion from the annual to the weekly right on the same page.
Oh, thanks. That was Raphael's idea. I can't take credit for that. Okay, and so the next question was related to where Oregonians fell in terms of tax brackets. And the most recent year we were able to get filings for was 2023. We reached out to the employment department for 2024 numbers, and those aren't quite ready. They're still working on those. And so this basically breaks out the number of returns by income tax bracket, which is separated into how that looks in terms of individuals and married couples. And this uses adjusted gross income. So that's taxable income, which is usually for most people less than their actual gross income. It's their taxable income. So it's not quite apples to apples. It's apples to oranges a little bit, but you know, it seems like a majority of income. Well, the way the tax brackets are broken out is probably less useful than the breakout in the next table, because there's a huge kind of catch-all category with an effective tax rate of 5.8%. That's anyone that makes $9,451,000 to $125,000 for singles, or $18,000 to $250,000 for couples. That captures, almost 3/4 of Oregonians that filed taxes in 23. But if you look at the second table, table 4, that looks at the breakout of returns by adjusted gross income level, broken out into $25,000 increments. And again, it's not quite directly applicable because it is adjusted gross income, but a majority of returns fell into that below $100,000 level. And I don't know if I could do the math here really quickly, but it's like probably 25% or so are above $125,000. But a full 50% are right around that or below that $50,000 per year level.
Also helpful how you have the percentages of the returns being single, married, or other, which is great. So thank you for doing that.
Yeah, you're welcome. So if anyone has any questions, or if you have any follow-up questions for things that the DCBS research team could look into, we're happy to do our best, make our best effort to do that. And I hope this is helpful.
Great, thank you.
I'm sorry,
yes.
my camera's not working.
No, that's fine. It seems to have answered a lot of the questions. And given the lack of additional questions, at least at this time that I'm seeing, I think that it was a well put together presentation. I guess one point of clarification, that paid leave Oregon also includes continuation of healthcare benefits. Is that correct?
I believe it does. I would need to double check.
Great, thank you. Any other
You're welcome.
questions from folks, even including stakeholders? I see a hand up. Raphael?
Hi, everyone. My name is Raphael Robles. I'm one of the researchers here at DCBS. I helped Andrew with this presentation, and as he was talking about the paid leave Oregon, I thought of something that might also be helpful, just given the previous conversations from this committee. So that middle income section, where between 65 and 120% of state average weekly wage. So when you do the math and compare basically what they end up with to their normal take home, just for reference, it ranges from they get 99% of their normal take home if they're at the 65% of state average weekly wage. And then at the top limit of that, the 120%, they'd be taking home roughly 77% of their normal income. And it is taxable. The income from paid leave Oregon is taxable, so it would be fairly apples to apples to what they're normally taking home. I just thought that might be helpful to add. Just came to me as he was talking about it.
Great.
Thank you. That is helpful.
That is good. Thanks, Raphael.
Yes, thank you both for the presentation, the information. I think that's very helpful.
So co-chairs, I received an email from, sorry, I had it in front of me, Matt Lawrence, the attorney that joined us last meeting and shared all the information about taxation and all those different things. I did not email it out, but if you go to the average weekly wage subcommittee website, on the MLAC website, there is on today's meeting, August 22nd, 2025, there is a spot that says taxation of benefits, and there's a link to guide to taxation of employee disability benefits. There's another link for IRS taxable and non-taxable income, and there's a link to paid leave Oregon benefits. So we can thank Mr. Lawrence for providing that information.
Yes, thank you for that, Terry, and thank you to Mr. Lawrence, for that follow-up as well. I think that will be helpful. So any other questions or comments about the data on claims presentation and information? Not seeing any. I see next up we have policy discussion with average weekly wage for low-income workers and SB 705 in the -2. So I guess just kind of opening up if there's any comments or thoughts or stakeholder takeaways from the presentation, or Stacy, if you had any kind of thoughts or perspectives on this data as it applies to our sort of policy discussion.
Yeah, making sure no one else had comments. My thought is, as we're looking at this, I feel like we've collected our data. I think anything that we've requested, Terry's done a fabulous job of tracking that down, or it's just simply not available. Scott, do you agree with that sentiment?
I think for the most part, I think, you know, there may be kind of hyper-specific analysis points or something as we move forward that we can take a breather or ask for one of the very qualified researchers at DCBS to chase down a rabbit hole for us. But yeah, I feel like we have a pretty good war chest of information here to move forward with.
Yeah, I agree. So I think this is the point we've all been waiting for then, right? And so what I guess I would like to open up a discussion on what we think will be the most effective way to evaluate some different philosophies and how to tackle this. Do you have any thoughts on the best way to transition to that?
Yeah, so I think that's a good point. In thinking about it, I think the sort of the policy discussion generally around work comp is infinite in its bounds. So I think if we can have as much as possible sort of stakeholder driven engagement on identifying problems and fixes and how to move forward on that, then we can have the policy discussion sort of orbiting around something that may move forward legislatively or you know, in rule or however we're talking about analyzing this. And I think that's kind of, you know, one of the reasons I know AFSCME brought the proposal forward last time. I see Lamar's taken himself off camera, so probably allow him to chime in here in just a moment. But I feel like that may be the best use of time to have kind of direction towards something, that if there is a proposal that we have sort of discussion around that and the policy of that. But open to your thoughts on that, Stacy, or if we want to let Lamar jump in too.
Yeah, just 1 second, Lamar. Yeah, I was thinking similar. Part of me is wondering if this would be a time where we actually solicit some input from stakeholders to proposals to get us done. Obviously, we saw the proposal with 705-2. I don't think that completely scratched the itch from the MLAC perspective, but I think it was definitely a good start of getting the conversation rolling through this whole subcommittee. But I'm wondering if the assignment for all of us, and I might be getting ahead a little bit, but what was rolling around in my mind is thinking maybe the assignment for this group of stakeholders and whoever wanted to submit their thoughts is to actually collect some different thoughts around how this could work. And then we could start evaluating those during the next session. But that way we'd have some concrete ideas as opposed to just kind of discussions and kicking it around, because I think we could discuss it around and round and round for a good amount of time. I don't know how much that's going to move the ball forward. So that's what's rattling around in my mind right now, but would love to hear Lamar's thoughts as well. So thanks.
Yeah, please, Lamar.
Yeah. Thanks and good to see you all. Lamar Wise, Oregon AFSCME political director. So, you know, I guess just to kind of frame the conversation a little bit, and going back to, you know, some of the things that we discussed last meeting, I think the frame is around, or really the principles are around um, making sure that we are able to support the original intent of the law around workers' comp, which is again to support the person who was injured and to make sure that their dependents could also be able to um, survive off of the benefit, uh, until that doctor is able to release that person back to work, whether it be on modified or what have you. Um, with that being said, I think Morgan Absting's position is that 66 and 2/3, there's a ton of data at this point that we've seen where low wage workers are high utilizers of the benefit. And in addition to that, the cost of living has increased significantly. And so, we want to make sure that we are supporting the value set that is already in statute. With that being said, I think the -2 kind of left off at us negotiating around, I think it was 80%, right? Of so raising it from 66 and 2/3 to 80%. We recognize that that obviously did not we did not get to an agreement there, and so I think our next, I guess, proposal at this point is to get a sense of, okay, well, it's clear to us that it does need to increase. The question is how much, and we also want to stand clear of any other consequences. For example, tax consequences um, that may be associated with increasing the benefit. And so, I think our conversation here today, and for the other conversations that we'll have thereafter, is what is that number and what is a good phase and approach to that, so that it's not um, as burdensome to the folks on the management side, but also again is able to support what the law is supposed to actually be doing. And so I think that's our position, and we're open to a conversation on what that could be. Um, but we've heard from workers time and time again that it is insufficient, and that they do go back to work before they're supposed to, in order to survive, which is was not the point. So I'll pause there, and there's a ton of other great folks on here that I'm sure could chime in as well.
Great, thank you. Thoughts on that, Stacy, or other stakeholders have perspective or ideas they'd like to bring forth?
Yeah, I think Lamar summed up our work very well, and what we need to do and why we're here. Like I said, I kind of am back to the thought of would love to see some ideas, with some specific numbers and where people think that this would be a good win for both labor and management, and making sure that the system is able to support whatever changes that we recommend through this process. So I'm wondering, Scott, if now would be a time if anyone has anything right off the top of their head that they want to discuss, great. But I'm wondering if now is the time to maybe see if there's any clarification with what we're looking for, if that's the direction we want to go. Obviously, we need to decide if that is indeed the direction we want to go. But if so, I think then the assignment is everyone digging in, giving a little bit of thought, submitting any of their thoughts or proposals to how this could look. I would suggest we look at 702 or 705-2 and use that as a starting place. Like, let's not recreate the wheel or bring something completely out of left field unless we think that something's completely broken. But I would say, as we're looking at what those percentages would be, how we want to tie it to different metrics, I would strongly recommend that we tie it to a metric already being used by one of the state agencies, at least one that's used by at least one state agency, so that we can gain some consistency there, would be my suggestion. That's kind of where my head's at. Scott, do you agree with any of that? Have some other differing thoughts?
Yeah, so just if I can feedback to make sure that I'm kind of understanding and processing, the idea being if there is a kind of policy goal from stakeholders, and asking in particular of kind of if there seems to be a need, especially for lower income, that there be a sort of threshold that's drawn in a way similar to other agencies, or kind of pre-existing threshold, maybe one of the ones that's identified here, maybe sort of, linked to that somehow.
Yeah, I think it'd be great if we could, if we decide that we need to make a change, that we're at least tying it to something already in use instead of creating something brand new, because whatever we do, I feel like we could make it really complex really fast, and would love to see us not do that if at all possible. Looks like Paloma has something to say, which is great.
Sure. Yeah, no, and I hear you on that. And I think from a labor perspective, and in my thinking of it, as I've made the joke before, I'd much rather see the benefits be paid to injured workers than be paid to reprogram the software to have more and more arcane ways of calculating the rates actually do, right? So, but yes, Paloma, please.
Yeah, I just looking at sort of the conversation around pay leave Oregon, I would just say that to us that feels very different. One, that was a very complicated, long drawn out negotiation, based on a lot of factors. But also, the reason why that exists that way, I mean, in part, is because employees pay the majority of the cost of the program for paid leave Oregon, and some employers don't pay into it at all. So just to flag the sort of complexity of comparing those as if they are apples to apples, is concerning to us. I would prefer, if we're sort of going down this path, that we look at how other states have approached it. For example, Washington does have an escalator that is higher, but it's based on the number of dependents, not necessarily on what the employee earned. So just wanted to flag those items.
Yeah, I think that's a great comment, Colonel, and I think that's kind of the request is, what are those different, we'd love to hear, or at least I don't want to speak for Scott, but speaking for myself, I would love to hear the different ideas that stakeholders think could make this program successful, and what that setup would be. Again, back to like just data points, if we could use some existing data points, if we get to the point where we are having a scale or something like that, I think that would be good to keep that with something that's already defined by the state. But again, it doesn't have to be something as complex as paid family leave by any means. It could be where it is purely a percent, like we saw with some of the other states and how they're doing it. Could be by dependent. I think there's a lot of different options, and so I would love to hear thoughts from our stakeholders on how they envision this could be a good way to tackle this. And then my thought is we could then evaluate some of those proposals or calculations and see which way we think would make the most sense going forward. Again, with the goal for myself is, let's keep it as simple as we can and use metrics or data points that are already existing instead of creating new ones.
Thank you, Stacy. I saw Lamar came on camera again. Did you have additional input, Lamar?
Yeah, I guess response to Paloma, and then, I guess continue framing, which is, I absolutely think that we should be thinking about dependents as we think about this. I do think that I guess I don't want the perfect to be the enemy of the good in terms of us making progress. And so I guess I'm just saying that we're open to kind of doing this policy in sections. If that means that we talk about figuring out the base this time around, and then next year we talk about dependence, I think that's something that we should consider. I just want to make sure that we are, that we're giving enough space and room for each discussion, and then obviously I want to also make sure that that we are making progress in a timely fashion, because probably don't have to let you all know this, but there's a lot going on where workers feel like they're being attacked, and making sure that we have at least this kind of set in place is a signal that this is something that we are prioritizing. With that being said, I'm happy for us to come up with a full scale proposal at the next meeting. I do think, and would love to hear feedback on this. I do think elements of it should include, the years of a phase in, and then making sure that we are hitting a percentage um, that avoids a tax consequence. And so I think we have the data to do that. I think we'll just need a little bit more time to make sure that we are putting that together in a way that you all can look at it and also give feedback. But that's what we're thinking in terms of the frame. I guess my question to the group is, besides the dependence, which I've heard in looking at other states and how they've done it, if there are other things that we should be taking into account, or if whatever happened in the last session, if there are other things that were brought up that we wanted to that we should just be aware of, and just full transparency. I think Odalise has been leading on this for Oregon AFSCME, so I'm coming in on this a little bit later, but have been up to date on most of the conversation. So I just want to make sure that we're not missing anything, for us to come up with a proposal that is, digestible and makes sense to the needs of the group.
I mean, my suggestion is we have all the data on the MLAC site, and so all of the different proposals that we've listened to the past several meetings with this group. I would suggest that we all reference that data, spend a little time with that. I also want to be clear, and again, don't want to speak for Scott, but my intention is not for someone to put together a big fancy proposal. Really, it's just hey, this is something that could work. So please don't spend time in an elaborate presentation or anything like that. Really, we just want some good ideas, maybe show example calculation or that type of thing to work through the thought of it. But there's this is a collaborative effort, so there isn't an intention for the best proposal wins or anything like that. It's really just let's get some ideas together that we can all look at and then figure out how to make this something that we could all agree upon.
So, and I think if I'm hearing you correctly, Stacy, kind of let's do a back of the envelope rough idea. We'll feed that through, I'm sure, NCCI to get some information back on cost. We'll also have some kind of discussion on the policy to make sure that it seems to be within the ballpark of, accomplishing a labor perspective of the needs of workers and their families. But also, I know that there've been some policy concerns that you've raised from kind of a management perspective as well. So that we're kind of, within the ballpark there, and then start talk numbers and see how that fits into the policy concerns as well, in the broader discussion. Is that fair?
Okay.
Okay.
Yes, totally agree. I mean, I think we've seen a lot of different ways that this could be done. And so now the request is, which one resonated with you, if any? If there isn't anything or you're not feeling passionate about it, that's fine. But if there are some that you think would work better than the others, please run through what that could look like from your perspective, and whether it's dependence, whether it's the scaling percentages. I think the important thing to remember is that and Paloma had mentioned this as well, is remember or identify which benefits you're looking at, which ones are taxed, which ones are not, because that's where we want to make sure that from my perspective, we're looking at this as close to apples as we can when we're looking at how other either other benefits work or how other states handle this. What do those impacts mean? I mean, we all know that worker comp is not taxable, but to Scott's point, there is a risk of losing insurance. It doesn't always happen, and so that's where it definitely gets gray. And so those are some of the things that we're going to have to acknowledge. There are some gray areas, but what could be a good framework to get us to a nice spot where we feel better about moving it forward from both sides.
Okay. I want to be mindful of time too. I know we have a hard stop at 2, so I see Thais's hand. I'll get to you in one moment. But I want to kind of encourage anybody that has any additional perspective that would be helpful in sort of in achieving this initial first step that we're talking, or I guess second step, because the first was probably data, or maybe the first was 705. Now we're 4 steps in, but irrelevant. But sort of that work that we're talking about to try and accomplish to take this next step, if there's anything that folks have to kind of bring to the table that will facilitate that work, I'd really encourage you to chime in now. Obviously follow up with Terry so that she can disseminate information. If you have, again, it's Friday afternoon, 20 minutes after the meeting ends, the perfect thing pops into your head. Please do follow up with emails so that we can kind of keep the interim work going on there. But Thais, I see your hand as well.
Yeah, sorry, thank you. I've just, as I'm thinking through these pieces and potential proposals, et cetera, I was reminded while reading the revisions to 705-2 this afternoon, in the discussions so far, have not brought up supplemental disability for those employees, injured workers who have multiple jobs at the time that they're injured. So I just, maybe a point out for stakeholders who are thinking about those pieces, also how to structure review of those multiple jobs when looking at the base average weekly wage. Or does anyone even care? But, just because. So, and my team is working on some thoughts based on the data that we've seen. So we'll try and get something over y'all to look at.
Great, thank you. And I guess there's a follow-up question I have for our friends at WCD about the average weekly wage data. I take it is I see at the bottom of the page the tax bracket information. Obviously, that's sort of aggregate, total all amongst all jobs for the tax filing. I'm assuming, correct me if I'm wrong on that. But for the average weekly wage data for the classifications that I know that a while back we'd received information about which of the sort of tiers in the samples where we had the sample spreadsheet with the tax brackets and the number of claims that fall into each of the tiers of income. I'm assuming that those income tiers and the claims information related to that was also across all multiple jobs. That perhaps was not phrased in the most coherent way, but do folks understand the question, and am I correct in that?
Andrew, is that your data research?
Can you repeat the question?
Yes. So a while ago, there was information about I'm trying to find it on the MLAC webpage so I can reference a specific document, but there was a kind of breakdown of the number of claims and the income tiers for each of those claims and the sort of percentage of claims that fell into each one of those income brackets. Were those income brackets based on total income? So if somebody had 3 jobs, their income bracket understandably includes all three of those jobs, or it's only the job for the employer at injury.
This might have been Raphael. I might be wrong.
Yeah, I wasn't involved in that analysis.
It was
Hi, Coach
Raphael.
Strickland. Yes, that was me. So
Sorry.
those income brackets were based on the actually about a back calculation of the employee's payout. So whatever they were actually being paid out, I did the reverse calculation to see what their average weekly wage was based on the payouts.
Gotcha. So as long as the worker reported the additional jobs, then that should be accounted for.
Correct.
Okay.
Possibly. So where supplemental disability gets complicated is that the majority of people receiving that benefit are not paid by the work comp claim, but are paid separately through Compro utilizing the state funds. The current review is you get your TTD payments, TPD payments on your claim at injury. And if you qualify for supplemental disability, that's paid separately, but with a cap to the overall average weekly wage between the benefits of the cap for that year on benefits overall. So I guess my concern as we're looking at possibly doing a tiered review, adjusting based on your percent of average weekly wage versus the state's average weekly wage, et cetera, in those future calculations, including both for where that tier hits versus just not really worrying about it, if that makes any sense.
So short version, it depends.
Yeah.
Is there maybe a number of claims where that concern could be triggered? You know, that maybe is it 2%? Is it 20? Is it whatever percentage of the claims that you could throw out there or get your folks to identify?
I'd have to review it and talk to Compro and see what they've got for data on that. I guess where my brain is concerned is there are a lot of people who are injured maybe on what is their second job. So the average weekly wage for that job is, you know, $200-300 a week, but their main job is several thousand, depending, you know, on what their main industry is. So would we be looking at your job at injury, average weekly wage, you're in that low income earner, but in reality, you're actually at or near max wage earner when you look at that combined average weekly wage between the two different benefits.
Great. Thank you. I think that's exactly the kind of stakeholder feedback we're looking for to kind of like in taking the next step.
Yeah.
What are the things we need to be aware of and kind of the questions we need to be ready to address for folks that are, you know, as we all move through the next steps on this path.
Oh, and I will research more, but thank you.
Thank you. Other input, thoughts, concerns?
Co-chairs, we have a wealth of data on the average weekly wage subcommittee website. I was just going through it when Paloma was talking about Washington. When Summer did the summary of other states, the claim data you were just referencing, short and long-term disability, there is tons of information on the website. So I just wanted to refer people to that website.
Yes, thank you for that flag. And I think there is a ton of accessible information there. I think it'd be good to review that. other thoughts, input?
Do we want to establish a due date, so to speak, for any ideas or back of the napkin math, whatever it may be that people are coming up with? Do we want to ask for a date so that we have a little bit of time to compile that?
I don't know that we're at that step yet. I'd kind of like to see next meeting what stakeholders come forth with, and in the interim as well. I feel like that we have a pretty motivated crew here. So I would maybe not worry too much about that yet. I think if things start to stall out, or there start to be sort of a delay, or we don't see progress to the next step, then I think we can kind of rein that in. But I would be hesitant to, when we take the first step into the policy sphere, sort of limiting that in a way. But I'm open to input or other thoughts on that.
To that, oh, I'm
Yeah,
sorry.
sorry, Terry. No, go ahead, Terry.
To that point, we actually have an early meeting next month. It's Thursday, September 4th. I think there was some scheduling on co-chair's part. So it may be then that we have some really solid thoughts and ideas come in on that Thursday, September 4th meeting. And then we'll be able to put everything together before our final meeting on Friday, September 26th.
So thought then is for people just to present their thought at the next meeting. Is that what you're thinking, instead of getting some of that ahead of time to organize? Okay.
Well, I'd say as soon as you have it, send it, with the understanding that there'll be a placeholder in that meeting to discuss and present further and answer questions. But as soon as ideas and things are completed, and as soon as folks come up with additional thoughts or concerns, please send that in, because we are trying to push this timeline along. I would just be hesitant, because I know sometimes, somebody puts the back of the envelope together, but the presentation's different. And so I just want to allow for a little bit of leeway there.
Yeah, I think it's absolutely continuing discussion, but I think it would be helpful to have some of that information ahead of time, just so that we can help, maybe it's even, we identify two groups coming up with a similar idea, and maybe it's pairing them up to flesh something out together. I mean, it could be easy like that too, but I think it would be helpful to see the information as people have it available, but before the next meeting. So that's right. Didn't know if we wanted to say by next Friday, if you are able to put something together, give it to Terry so that she can help us compile that. But if you bring something the day of the meeting too, that's fine. But it would be nice to have some of that ahead of time, just to get an idea of what we're looking at. And it can help guide the direction of the meeting as well.
Yeah, and I would say, as much as possible, kind of putting the onus on us too, as the co-chairs, to go back with the stakeholders, and kind of push that, I get in touch with the labor folks and kind of push them along, and then also get in touch with you, and then try and kind of coordinate some of the stakeholders engaging with each other and following up, so that we have something a little more polished for the presentation at the meeting, with a little more kind of a structured understanding of that, and the information shared to everybody, so that even if they aren't able to connect in the interim, that they have access to the information and can come in with thoughts and some analysis.
Agreed. So targeting next Friday, the 29th, work for you both then, to have that as a soft deadline, to have some of that to put together, so we can drive some of that.
I'd say unofficially, yes. I have negotiations all next week with an employer, so I can't guarantee that it will be Friday end of day, but I will be driving stakeholder engagement starting right after this meeting. So
yeah, I'm thinking it's just it's helpful for stakeholders to know kind of dates that we're thinking. So just wanted to provide the group with some clarity around a date to push forward on. So
agreed. Yeah, I think pointing to the 29th for a sort of unofficial deadline for folks to really orient around is, I don't have a problem with that.
Good.
Any other thoughts from folks? Stakeholder engagement?
And even if your ideas aren't completely fleshed out and you just have a wild idea, email it to me. Okay?
I see Odalise came off mute too.
Yeah, I just wanted to put a last call out there as we're putting proposals together. I remember, I think it was a couple of meetings ago, where someone mentioned to not reinvent the definition of average weekly wage. So as I'll be crafting this like new proposal, is there anything else that we should stay away from and not do? We've been working on this now for I think it's going to be almost a year since we started developing the policy. So I want to make sure that I'm, encompassing all of the different concerns and at least having like a good starting off point where we can discuss at the next meeting, hopefully. And then even during the interim, I'll put my email in the chat, but always feel free to reach out if there's something that you think of that we should be incorporating.
Great. Thank you for that, Odalise. All right. Well, we're closing in on the 2 p.m. cutoff. I do want to thank everybody. If you do not have Terry's contact information yet, I believe it is on the MLAC website, if that is correct.
Yes, it is.
So please do get in touch, and thank you everyone in advance for your work and consideration on that. So thank you, and we can go ahead and adjourn.
Thank you. Have a good weekend.
Thank you.
Cool, everybody. Thanks.